Is vitrectomy surgery effective for retinal detachment? Imagine suddenly seeing a shadow or a curtain blocking part of your vision. That could be a sign of retinal detachment, a serious condition where the retina pulls away from the back of the eye. One of the main treatments for this is vitrectomy surgery. But how effective is it really? Let's explore. Vitrectomy surgery is a common and highly effective procedure for treating retinal detachment, especially for a type called rhegmatogenous retinal detachment. This type happens when a tear or break in the retina allows fluid to get underneath and cause it to lift away. During the surgery, the eye surgeon removes the vitreous gel, which is a clear, jelly-like substance inside the eye. Removing this gel relieves traction on the retina and helps it to reattach properly. Studies show that vitrectomy has a very high success rate. In fact, about 90% or more of cases achieve successful reattachment after just one surgery. For example, one large study reported an almost 90% primary success rate, and if additional surgeries are needed, the final success rate can reach 100%. Another study found that with newer techniques, the success rate can be as high as 97% on the first try. Compared to other treatments like scleral buccal surgery, vitrectomy performs just as well or better. Success rates for scleral buccal are similar, around 90%, but pneumatic retinopexy, another less invasive method, tends to have lower success rates, around 70 to 80%. The advantage of vitrectomy is that it directly addresses the cause of the tear and reduces the chance of future detachment. Advances in technology have made vitrectomy safer and more effective. Smaller instruments and better visualization allow surgeons to work more precisely, which improves outcomes and reduces risks. It is especially helpful when there is bleeding inside the eye, many tears, or if the patient has had previous eye surgery like cataracts removal with an artificial lens. Most patients who undergo vitrectomy experience significant improvement in their vision, especially if the detachment is caught early. The final visual outcome depends on factors such as whether the central part of the retina, called the macula, was involved, and how quickly the surgery was performed. Of course, like any surgery, vitrectomy has some risks. These include the development of cataracts, infection, or the retina detaching again. However, overall, it tends to have fewer complications compared to some other procedures. In summary, vitrectomy is a highly effective option for repairing retinal detachment. It offers high success rates, especially when performed promptly and with modern techniques. If you suspect retinal detachment or have been diagnosed, consulting with a retinal specialist is essential to determine the best treatment plan tailored to your specific needs. Remember, early treatment is key to preserving your vision and eye health.